Welcome to this week's Wellness Wednesday. You might not know that almost 1/3 of injuries in childhood are sports-related injuries. This evening, we are joined by orthopedic surgeon Taylor Mathis to discuss ways to prevent and treat a sports-related injury. How are you doing today?
Good. How are you?
All right. I'm doing pretty good.
Yeah.
So what are some of the most common injuries that you see in youth sports?
Yeah. So in youth sports, you see all the same injuries you see in adult sports, whether it be ACL tears, shoulder injuries, shoulder dislocations, tendon injuries, fractures, but you also have the added element of a growing skeleton. So you have a growth plate and you have a weak spot there in the bone where an adult it might not be there. And in an adult, it would maybe lead to a ligament injury, but in a child, it leads to a fracture through the growth plate. You have overuse injuries, especially in such a rise we've seen in the last few decades with youth sports and super specialization in a single sport at young ages where we used to never see that. So you get, baseball especially. We talk a lot about the Tommy John injuries, the UCL in the elbow, or overuse injuries from repetitive motions over and over and over, where kids used to have different seasons where they played different sports and did different motions. That's really become such a super specialized thing. So we see different types of injuries because of that.
And for all of the parents and coaches out there, how can they help young players avoid a lot of these injuries?
So I think preparation is important. Kids have to be in shape. They need to be active in not just one sport, but multiple sports across multiple different types of movements. That helps all the different muscle groups, helps them be explosive in different sports, but also prepares them in different ways than just one single sport might prepare them. And that's hard because, as we know, travel sports have gotten to be such a, I hate to say problem, but it's led to some problems that we've seen because of it.
Absolutely. And I think a lot of people would like to know, how do you work with the players to get them back on the field?
Yeah, so it's all patient specific. The demands for a baseball player are different than a football player. It all depends on their injury. Some injuries, they're going to need surgery right away. You fix their fracture or their torn ligament or fix their meniscus tear, and then that leads towards a recovery. Then you have others that don't need surgery, but they need physical therapy or they need to work with their athletic trainer. We work with North Mississippi Medical Center's athletic training group with high school students around the area. You have to work to get them back to what sport is they want to do. And all those demands are different. That's what makes it interesting.
Yeah, absolutely. Well, I appreciate you coming in this afternoon. I'm sure that all the parents and coaches really appreciate it too, so thank you very much.
Thank you.
I appreciate it.